Okay, this is the memorandum from HEALA, the Healthy Living Alliance. HEALA calls for accountability and public transparency from Finance Minister Godongwana, the power of the health promotion levy. HEALA believes in food justice and for all South Africans to have equitable access to affordable and nutritious food. We know that this can be achieved through strengthening food policies that protect the public against unhealthy food environments that promote ill health. The economic, household, and individual costs of not realizing the right to food are placing our people at a disadvantage. Since the health promotion levy was introduced in April 2018, it has already shown positive results in changing consumer behavior, but it has the potential to do much more. It can protect South Africans' health and human rights while increasing revenue for the government to spend on projects that enhance our people's lives. It even has the potential to address climate change and the threat it poses on human health. However, the HPL is constantly under threat through non-transparent dealings with the private sector that dilute, delegitimize, and delay the increase of the HPL to 20%. We call on the government to wholeheartedly commit to strengthening the health promotion levy, an existing and successful health policy that benefits both the public's health and the National Treasury's pockets. During the 2022 budget speech, the Minister of Finance announced a planned increase to the HPL of 4.5%, raising the levy from 2.21 cents to 2.31 cents per gram of sugar-sweetened beverages. HEALA welcomed this announcement, and it will be the first increase since the HPL was enacted in 2018. To HEALA's disappointment, the National Treasury postponed the increase to 2023 April. We believe that the decision to postpone the increase to the health promotion levy was a result of sugar industry interference and lobbying. There are deep historical roots of the South African sugar industry and its influence on dietary sugar consumption at the population level. The sugar industry is a prime example of a colonial activity shaping the economy, polity, penetration of sugar content into food products, and blocking proven health policies for an extended period. With the soaring health conditions linked to unhealthy food, the reliance on sugar and energy-dense diet for industry profiteering is no longer sustainable. The National Treasury has not given the reason for this postponement or how the decision was made. This lack of transparency and accountability is worrying, especially regarding a food policy that helps prevent unhealthy consumption of sugar-sweetened beverages. And protects the public against obesity and other life-threatening non-communicable diseases such as diabetes, heart disease, and some cancers. We have been trying to have productive engagement to get answers from the National Treasury about the meetings that led to the decision to postpone the increase. However, these requests have been ignored. We submitted a Public Access to Information Act application to the National Treasury. This application has also been ignored. We believe National Treasury has failed to follow the Promotion of Access to Information Act by not responding to our request to access this information. HEALA believes in food justice and for all South Africans to have equitable access to affordable and nutritious food. We know that this can be achieved through strengthening food policies that protect the public against unhealthy food environments. The economic, household, and individual costs of not realizing the right to food are placing the people at a disadvantage to develop into a flourishing nation. And these are our list of our demands. HEALA calls on the government to commit to strengthening the health promotion levy, an existing and successful health policy that benefits both the public's health and government fiscals. Treasury must explain why a postponement of the increase is now considered an essential requirement to enable consultations to expand the levy and reduce the threshold, especially when the announcements made in the 2022 budget indicated no conflict between the two processes. The National Treasury must raise the HPL to the intended 20% and begin the process of expansion to fruit juices and lowering the 4-gram threshold. And lastly, that the intended health promotion levy process for consultations, including timeframes and stakeholders, is transparent to the public at the soonest possible opportunity to help build confidence and ensure proper participation. Thank you.
Manza. So comrades, from Saina.